Hi everyone, this is Mr. Matus and I'm here today to discuss with you therapeutic communication. Therapeutic communication is a very important concept in psychiatric nursing, and it is also a concept that is applicable to all other areas of nursing. Always remember that concepts on mental health nursing, especially therapeutic communication, is not only for psych nursing, but it's applicable to all other areas of nursing. So what I'll be doing today is I'll be giving you examples of the different nursing responses, and then after that I'll be giving the answers if they are therapeutic or non-therapeutic, and also be giving you a little bit of the rationale for the answers. And aside from that, I'll be also giving you some NCLEX tips on how to answer questions on communication techniques in your NCLEX. So let's proceed and discuss this topic. So the first example is the nurse says, "Don't worry, everything will be okay." I think that in nursing, you have always heard that false reassurances are never correct. So in this situation, the answer to this is non-therapeutic, because this is an example of false reassurance. So the next example is the nurse says, "I'm sorry, what did you say?" In this situation, this is considered to be non-therapeutic. And the reason for this is because the nurse is not listening. In a nurse-patient relationship, it is very important that the nurse shows interest when the patient is expressing his feelings. And if the nurse is not following the conversation, the patient will hesitate to discuss further his problems because the nurse is not listening. Number 3 example, the nurse says, "Tell me about that." This is considered to be a therapeutic nursing response. It encourages the patient to verbalize his feelings or his emotions, for example, like fear or anxiety. And this is always usually a very good answer in the NCLEX. Next example is, the nurse says, "You are not the king of Spain." Perhaps this example applies to patients who are having delusions. And when the nurse responds by saying, "You are not the king of Spain," this is considered to be non-therapeutic. And the reason is because it is challenging the patient. It is a form of disagreement or not agreeing with the patient. Always remember that when patients have delusions, nurses are not supposed to agree or disagree with the delusions. So this kind of response in the NCLEX is considered to be wrong. The nurse says, "Why do you think that way?" This response is considered to be non-therapeutic. And the reason is because it starts with the word why. Anything in the NCLEX that starts with the word why is considered to be wrong if found in the nursing response. Because starting the statement with the word why makes the patient defensive. So don't start the conversation with the word why. The only time in the NCLEX, so this is an NCLEX tip, the only time in the NCLEX that why is correct when you use that in the nursing response is when the nurse says, for example, "Why don't we discuss your situation? Why don't you tell me more about your problem?" That is correct. But aside from that, anything that starts with why is wrong because it makes the patient defensive, and that is the reason. Another example, the nurse says, "Your doctor is the best in this practice." This nursing response is non-therapeutic because it is very defensive. If a patient is complained about the physician and responding this way, the patient will feel so frustrated that you are not concerned about his feelings because you are really very defensive. Another example, the nurse says, "The policy is one out on pass, which we must comply." So this applies in situation when patients are manipulative or they're asking for a favor, which may not be in compliance with the policy in the unit. So this is considered to be therapeutic because in this nursing response, the nurse shows that she is consistent. And in any nurse-patient relationship, it is very important for the nurse to be consistent because that promotes trust. And if the nurse is not consistent, that will lead to the patient not trusting the nurse later on, or the other patients as well, because there is a breakdown in the consistency, especially in terms of policy. The patient says, my father always puts me down, and the nurse says, that's interesting, but let's talk about your condition. This nursing response is considered to be non-therapeutic. And the reason is because the nurse is changing the subject. In any nurse-patient interaction, it's very important that the nurse focuses on the patient's concerns. And if the nurse is changing the topic or the subject, that is non-therapeutic. The nurse says, I think you should. This response is considered to be non-therapeutic because the nurse is giving advice. In a nurse-patient relationship, the one who decides is always the patient. The nurse's role is only to help the patient look at the alternatives or options. But in the end, the patient is the one who's deciding because, number one, you don't want the nurse to be blamed. The nurse should not be the one to blame in the end if something goes wrong with the decision. So it has to be the patient who has to make the final decision. The nurse says this is certainly not a moral thing to do. This is considered to be a non-therapeutic response because the nurse is very judgmental and imposing his or her own religious or spiritual beliefs to the patient, and that is not therapeutic. The nurse says, that is interesting, please continue. This is considered to be a therapeutic nursing response because it encourages the patient to verbalize concerns or feelings or problems. The nurse says, that's nothing compared to the other patient's problem. This nursing response is considered to be non-therapeutic because the nurse is trying to belittle the patient's problem. Every patient's perception of a problem is different. So for the nurse to judge the patient's problem by comparing it with the other patient's problem is not therapeutic. The nurse says, I hear what you are saying. It must be difficult. In the NCLEX, this is always therapeutic because it shows that the nurse has empathy towards the patient's feelings. And empathy is the ability of the nurse to put herself in the shoes of her patient. And this is therapeutic in nursing communication. The nurse says, let's discuss other options. This is considered to be a therapeutic nursing response because the nurse helps the patient look at all the alternatives or options. And in the end, the nurse will allow the patient to decide on how to approach the situation or resolve the problem. The nurse tells the patient, can you tell me why you want to leave your husband? In this situation, this is considered to be a therapeutic nurse communication or nursing response. And the reason is because the nurse is encouraging the patient to verbalize or express his or her feelings. And although there's a word why in there, but this is a different situation because this is more of encouraging the patient to verbalize his or her feelings. All right, so that was a very quick review of therapeutic communication, and I hope everyone that this will help you in your NCLEX. And before I end, please don't forget to click like, share, or subscribe to my channel. And you can always visit also my website, which is www.matusnursingreview.com. Thank you very much, everyone.